You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you very much for being with me again, or if this is your first time, then welcome on board. This is the place where I talk about all things holistic dentistry and how your mouth, teeth, gums, and the health of those structures relates to the health and wellness of your body and vice versa, and the importance of choosing the right things for you when it comes to your dental treatments. If you'd like to know more, then hop on over to holisticdentistry.au or check out my dental practice website, evolvedental.com.au. Today, I'm going to talk about the oral systemic link. And that basically is the exploration of how dental health and your overall health go hand in hand, and how poor dental health can be responsible for or related to or a causative or aggravating factor for many health conditions in your body. So let's get to it. Let's get in the zone. So there are diseases that are caused by poor dental hygiene, and dental hygiene and issues with it cause problems beyond your mouth, teeth, and gums. Look, we all know that poor dental hygiene increases your risk for tooth decay and gum disease. But when it comes to the link between your oral health and systemic disease and illness, this fact is not so widely understood, and it's not so well communicated within the dental profession. Now, dentistry has gone down this avenue of, talking about healthy mouth, healthy smile, white teeth, attractive smile, and that's great. But we also need to get the message out that if you've got issues with your mouth and teeth, that can cause issues in your body. So what is the oral systemic health link, and how does poor dental hygiene cause disease? Well, oral systemic health is a term that we are using to showcase the rising and important research-based links or connections between oral health and whole body health. Research has shown that there's countless health issues caused by poor oral health. Now, oral systemic health is connected to things like cardiovascular disease, Alzheimer's disease, obviously gum disease because it's going on in the mouth, but gum disease is a systemic issue. It's not a localized problem. It's linked and connected to diabetes, high-risk pregnancy, cancer, obesity, obstructive sleep apnea, and that's just to name a few for starters. Your mouth is the gateway for the rest of your body. You ingest things through your mouth, you swallow, and you take things in. But your mouth also has a massive connection of blood vessels and nerve supply, lymphatic drainage, and all that is connected to the rest of your body. We are continuing to find as healthcare professionals more and more supporting evidence of this oral systemic link, and it's not new. Physicians 250 years ago understood this problem. Maybe not in the detail that we do, but they knew if you had problems in your mouth, that could lead to issues in your body. Now, symptoms of health issues such as diabetes and cancer, cardiovascular disease, these can be first detected in your mouth. There are things that we can see going on in there where we get to look inside your body and it is telling us that something's not right. Now, the problem occurs because you end up with high-risk bacteria that begin in the mouth, entering the bloodstream, and that can lead to catastrophic systemic conditions. So if you've got gum disease and gums that bleed, when you bleed from your gums, bacteria from your mouth are entering your bloodstream, and then they're whizzing off like cars on the motorway all around your body, taking pit stops and causing problems elsewhere. So a really simple preventive measure is to make sure you've got healthy gums and a healthy mouth. So what are the diseases caused by poor dental hygiene? Well, number one, cardiovascular disease. They reckon that between 80 to 90% of heart disease can be prevented. through lifestyle, diet, exercise, and so forth. Now, proper dental hygiene is just one way to lower the risk for developing cardiovascular disease, because periodontal, aka gum disease, is directly linked to inflammation of the arteries. Bacteria from the mouth enter the bloodstream, and that causes the arteries to harden, which in turn increases your risk for stroke and heart attack. Poor oral health is related to high blood pressure and the dense LDL cholesterol, which further increases your cardiovascular risk. So, how do you prevent this buildup? Well, it's quite simple. You prevent gum disease by correctly caring for your teeth with brushing and flossing, making sure that you're timing how long you brush for, and visiting your dentist and your dentist hygienist regularly to get your gums cared for. But likewise, I think it's really essential for dentists and medical providers to educate the patients, you, the public, and that's what I'm doing in these podcasts and my videos and so forth, on the increased risks of poor oral health, the risk that that has on your whole body health. Now, we need to get it from the dental profession into mainstream medicine, that they need to be asking their patients, like, hey, you've got high blood pressure, do your gums bleed? Hey, you've got this, do your gums bleed? Or, hey, do your gums bleed? You know that this puts you at risk of X, Y, and Z. We need to get this message far more across and not just be talking about giving you nice white teeth. So, poor oral health will cause inflamed gums, and when bacteria leave your mouth, they can travel to the brain and they can kill brain cells, leading to memory loss. So, poor oral hygiene and the implications of that, the oral bacteria are traveling out of your mouth and they are implicated in the development of Alzheimer's disease and dementia. Pathogenic oral bacteria called spirochetes have been well studied as a potential cause of Alzheimer's. The presence and the frequency of these spirochetes, which are normally only found in the mouth, are significantly higher in Alzheimer's patients' brains than in people who don't have Alzheimer's. We can use salivary diagnostic testing to detect the presence of these oral pathogens and then treat them accordingly. Diabetes. Number 3. About 40 million Americans have diabetes. Many are unaware and many are undiagnosed. So if you extrapolate that to countries like the UK, Australia, Europe as a continent, then your uprising areas like the richer and more middle class populations in like China and India, for example, where they're having more westernized diets, then you've got to say that there's a massive amount of people globally who have diabetes. In Australia, the current rate they're saying is around 10% of the population have type 2 diabetes. I would suggest it's probably higher than that because many, many more have what we would call high end blood sugar levels or pre diabetes. If we added that in, then there's about 40% of the population who are trending towards having type 2 diabetes, a totally preventable disease, a disease that is not taken seriously enough because, oh, it's just I've got a bit of high blood sugar and I can take this medication. No, diabetes is life threatening. Diabetes increases your risk for infection, including infection of your gums. And then when you've got gum disease or periodontal disease, it makes it more difficult for your body to control your blood sugar levels and can increase your complications from diabetes and increase your risk for developing diabetes. We're getting caught in a catch-22. The studies have shown that 95% of adults with diabetes also have periodontal disease. Does that not say that there's some dualistic cause and effect thing going on there? Studies have shown that patients with periodontal disease have high markers for blood sugars. They also have high markers for C-reactive protein, and those things will indicate your risk for cardiovascular disease and diabetes. When patients have been treated for their gum disease Subsequent blood tests have shown reduction in blood sugars and reduction in markers like C-reactive protein. So this isn't just, hypothetical. This is actual fact and research backed. Number 4, poor dental health can lead to high-risk pregnancy. According to studies, women who have periodontal disease are 6 times more likely to give birth prematurely than women with no periodontal gum disease. Now, there's a bacteria called Fusobacterium nucleatum, which is present in the oral cavity, and that has been found in the amniotic fluid, the placenta, and the chorioamniotic membranes of preterm birth babies, in the mothers who give birth preterm. And there's thinking that those bacteria, they cause an inflammatory reaction that brings on early labor. Another thing that gum disease has been linked with pregnancy is failure to thrive babies, where they just don't grow and put on enough weight during the pregnancy. So again, there's some thought that the inflammation is restricting adequate fuel and nutrient uptake into the developing fetus. Now, this one may not be caused by poor oral health, but it is linked to poor oral health, and this is obstructive sleep apnea. But the reason I raise this is because one of the first signs of obstructive sleep apnea is heavy teeth clenching and grinding, particularly grinding, and this leads to wear and breakdown of the teeth, cracking and breaking of teeth, and destruction of, dental restorations and fillings. And it's a sign that all dentists and hygienists should look for in their patients. Now, grinding teeth, that can as well as the destruction I've just spoken about, that can cause cavities, it can cause inflamed gums, and it can increase susceptibility to infection. Now, sleep apnea, because of its mode of operation, because of the way it restricts airflow, it increases cortisol and adrenaline levels and heart rate. It's linked to high blood pressure, it's linked to heart disease, and it's linked to headaches, depression, and cognitive difficulties. Now, we can work together with the medical team as your dentist, and we can help you to get diagnosed, we can help you to get treatment, and we can also provide treatments for obstructive sleep apnea. Gold standard is a CPAP machine, which pushes positive pressure air in when you stop breathing, but there are dental appliances that can also be used either separately or in conjunction with CPAP. Now, other things that I tend to look for when treating or diagnose sleep apnea is dry mouth, waking with sore throat, teeth grinding, TMJ issues. And so these things can be a bit of a giveaway. I'll also look to see whether you have a large tongue, a lot of soft dangly tissue at the back of your palate. I'll look to see if you've got swollen tonsils or a narrow airway. And if we see all these factors together, then we're going to suspect sleep apnea and send you for a sleep study. Poor dental health can be linked to respiratory disease. Now, this is not a new idea. Bacteria in the mouth can be inhaled into the lungs or travel through the bloodstream. And once in the lungs, those bacteria can lead to respiratory infections like bronchitis, pneumonia, congestive obstructive pulmonary disease, COPD, and lung diseases. So working with your dentist and your medical provider, especially if you have pre-existing respiratory problems, can reduce the progression of infection from the mouth to the lungs and stop you having so many respiratory issues. We'll move on. So I'm talking about how there's this oral systemic link, and I'm looking at it as a bit of a one-way street in this podcast today, in this episode of the Dental Zone. I'm looking at what's going out of the mouth into the body, and I may do in another episode how we look for signs and symptoms or warnings of other illness and disease based on what we see in your mouth. I think that would be a great one to cover for you, because again, then you understand why it's important to visit your dentist for regular checks and not to go only when you have a problem or not go at all. So, cancer. there is a strong correlation between periodontal disease and cancers, particularly pancreatic cancer, lung cancer, blood cancers are just a few that people with poor oral health have been studied to show that they've got higher risks for. Now, additionally, things like smoking, chewing tobacco, alcohol consumption, these increase your risks, not just only for lung cancers and other cancers, but also specifically for oral cancer. Now, oral cancer has a poor survival rate because it doesn't get detected early enough, and early detection is going to be critical for surviving oral cancer. And this is another reason why regular dental visits for checkups are a must. I screen my patients every exam for oral cancer. It takes 2 minutes and it can save somebody's life. So there's a link between rheumatoid arthritis and poor oral health. The studies have shown correlation between the bacteria. I'm going to have a go at saying this one. Aggregator-Bacter actinomycetocomitans. So I think I did pretty well there. And periodontal disease. So this bacteria AA causes an inflammatory response in the joints of patients with rheumatoid arthritis. And that inflammatory response is very similar to the response in a patient's mouth with periodontal disease, where you get swelling, you get inflammation of the soft tissues, and then you get breakdown of the bone within the jawbone, and you get the same thing going on in a rheumatic joint. Now, rheumatoid arthritis is an inflammatory condition. Poor oral health causes periodontal disease, that causes inflammation, and that inflammation will eventually make its way to the rest of the body, increasing inflammation elsewhere and causing a cascade, a knock-on effect that worsens a lot of these conditions or is linked to or causative for them. So again, another one that's not quite caused by gum disease, but there's definitely links and there's definitely things we can spot. The later stages of periodontal disease will cause loss of bone from inflammation and infection. Studies uncover links that periodontal disease affects bone throughout the body and not just the jawbone and teeth, and therefore there could potentially be a link between periodontal disease and osteoporosis. Now, research shows that estrogen deficiency, low mineral bone density, and low vitamin D levels occur in both osteoporosis and periodontal disease. They are risk factors that will make somebody more susceptible. So a lot of women, as they go into menopause, will start to show signs of periodontal disease where there was none before. And so we can also check on x-rays for low mineral bone density. We can see signs there, and we may send you for bone scans. Salivary testing, dental checkups, proper oral hygiene in collaboration with the appropriate diet and supplementation can lower your risk of periodontal disease and bone loss. And I have covered a lot of things on dental diet, what to eat for gum disease and preventing gum disease in many of my podcasts and my blogs on my website, evolvedental.com.au. So I'm trying to get a lot of information in here for you. I'm not going to go into lots of specifics and immense detail and everything. I just want to give you an overview to get you to start thinking, get you to start joining the dots and to understand this oral systemic link. So the next one I want to talk about very quickly is kidney disease. Again, the inflammation and infection from poor oral health travels through the bloodstream, making it more difficult for the body to fight off infections, and you can end up with kidney disease, and kidney disease can lead to cardiovascular disease, which is another consequence of poor oral health. Now, men, did you know this one? Can poor oral health affect your sex life? Well, the answer is yes, because it can cause erectile dysfunction. Periodontal disease opens pockets for infection in the mouth. The bacterial infection, yeah, you know where I'm going. The bacterial infection in the bloodstream cause inflamed blood vessels, and that can block the blood flow to the genitals. Now, one study showed that men with periodontal disease were 3 times more likely to experience erectile dysfunction than men with oral with a healthy oral cavity. Now, I will sometimes joke with some of my male patients that I am more familiar with, who've been coming to me for a long time, that as I'm doing their oral hygiene care, I'm telling them that this is their dental Viagra. And we have a little bit of a laugh, and we all blush, and we get a little bit embarrassed, but it's sweet, it's a little bit fun. I wouldn't do it with someone I don't know very well or didn't think could take the joke. But then it opens conversation. It opens conversation to the importance of having a good, healthy mouth to have a nice, healthy life and all the benefits that go with that. So, of course, periodontal disease is going to be caused by poor dental health. And as I'm trying to point out here, periodontal disease is not a localized infection, it is systemic. About half, maybe more, of all adults have some form of periodontal disease, and this continues to increase each year. The periodontal disease worsens, it decreases your ability to fight infection and inflammation while increasing your risk of severe systemic health consequences. Few people understand the risk factors for developing periodontal disease and the consequences of it on their systemic health. And this is why I bang on about it so much. The word periodontal means around the tooth. This gum disease results from infections and inflammation in the mouth. When the mouth and teeth are not adequately cared for, bacteria infects the gum tissues, creates inflammation in the mouth that destroys your gums and the supporting bone, leading to tooth loss and these systemic health lists that we've been talking about. Did you know that obesity and oral health both share common risk factors? Well, diet plays a significant role in your oral health, and without proper diet, oral health is at risk and your overall health is at stake. Now, while the causes of obesity can range from all sorts of things, maintaining a healthy weight is essential for optimizing your oral health, and then having good oral health is going to help your body to stabilize its weight and drop some weight. And then things like obstructive sleep apnea improve, blood pressure comes down, cardiovascular disease markers come down, diabetes improves, weight loss is one of the best things you can do for yourself if you're overweight, as well as brushing your teeth, flossing, and looking after your gums. Last one I want to touch on is infertility. Poor oral health affects fertility. It takes longer for a woman with poor dental hygiene to conceive than a woman with good oral health. It doesn't end in women. Studies have been shown that men with poor oral health have lower sperm count and reduce sperm motility. So there are a myriad of reasons here for you to A, take better care of your teeth and gums, B, visit your dentist regularly, and C, take your dental health more seriously. So preventing diseases caused by poor dental hygiene. The research is showing the increasing importance of prioritizing oral health connections with oral systemic health. So how do you stop this? Well, first of all, brush, floss, clean in between your teeth, use electric toothbrush, mouthwash, coconut oil pulling, tongue scraping, bicarb with hydrogen peroxide. Again, that's covered in blogs and other podcasts. But how can you be sure if you've got periodontal disease or not? Well, first of all, you might see some signs of bleeding when you brush. You might notice your gums are a bit swollen or receding. You might have some bad breath or funny taste in your mouth. You may even notice your teeth are starting to shift or drift, getting a little bit wobbly. Your gums feel swollen and tender. Those are all things that show you're in the stages of periodontal disease. Now, oral testing can show risk factors and inflammatory markers for developing periodontal disease, and professional teeth cleaning and regular checkups can lower your risk. So I would urge you to make an appointment with a holistic dentist or a dentist who really is into the oral systemic link, and ensure you know exactly what is happening in your mouth, get it appropriately treated, and move to prevent health issues that could have been avoided just by having better oral hygiene. Well, I hope you found that enlightening and it's opened your eyes to the oral systemic link and how important it is to have good dental health. If you'd like to know more, hop on over to evolvedental.com.au. If you're in the Brisbane area and you'd like me to be your dentist, then give us a call, 0737 201811, and me and my team would be very happy to take care of you. And until next time, brush, floss, look after your teeth and gums, and look after you, and stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.